If you've been feeling more tired than usual lately, if you have been waking up at night to use the bathroom more than you used to, or if you have noticed that no matter how much water you drink, you still cannot fully shake that thirst, stop right now and give me the next few minutes. Because what I am about to walk you through could be the most practically useful health information you have come across in a very long time. Not because it is dramatic or extreme, but because it is specific, it is real. And the vast majority of people watching this right now have never had it explained to them this clearly before. I am Dr. Megan Foster, and in over a decade of working in internal medicine and metabolic health, the single most common pattern I have seen is this. People come in with a diagnosis that surprised them. They say they had no idea. They felt tired. Sure, they were drinking more water than usual. Yes, they had some brain fog, some weight changes, some things they chalked up to getting older or being too busy. But they never connected the dots, and by the time someone did connect those dots, the window for the easiest and most impactful changes had already narrowed considerably. That is the problem I want to fix today. Not with fear, with information. In this video, I am going to walk you through 10 of the earliest and most telling signs that your blood sugar has been running higher than it should. We will go from the ones most people overlook entirely all the way to the one that consistently surprises people the most. And after the 10 signs, I want to give you a genuinely deep understanding of what is actually happening inside your body. What the research says about reversing this and what practical steps produce real results without making your life miserable in the process. Stay with me through this entire video because the information builds on itself and the most useful parts are layered throughout. Before we get into the list, let me ask you something honest. Have you noticed changes in your body over the last year or two that you have not been able to fully explain? Changes that are not dramatic enough to send you to the emergency room, but persistent enough that they are in the back of your mind. If that resonates, type yes in the comments. You might be surprised by how many people feel exactly the same way and have never said it out loud. Let me start with the foundation. What is actually happening when blood sugar goes wrong? Think of your bloodstream as a delivery highway in glucose, which is just sugar from the food you eat, as the packages that need to be delivered to your cells. Every cell in your body runs on glucose. Your heart, your brain, your muscles, your organs, they all need it. But glucose cannot just walk through the cell wall on its own. It needs insulin to open the door. Insulin is a hormone made by your pancreas, and its entire job is to act as a key. When you eat, your blood sugar rises, your pancreas releases insulin, insulin unlocks the cell doors, glucose flows in, your cells get energy, and blood sugar comes back down. Clean, efficient, elegant system. Now here is where it starts to go wrong. Over time, usually very gradually, your cells start to respond less and less to that insulin key. The locks get stiff. Insulin is still knocking, but the doors are not opening as easily. This is called insulin resistance. When that happens, your pancreas tries to compensate by making more insulin, knocking harder and more often, trying to force the doors open. For a while, this works. Your blood sugar stays in a reasonable range because your pancreas is working overtime. But here's the critical part that most people never hear. Your blood sugar can look normal on a routine test during this entire compensating period, even while serious changes are already happening inside your blood vessels, your organs, your nerves, and your immune system. This is why research has found people showing physical symptoms 5 to 10 years before a formal diagnosis. The damage does not wait for the diagnosis. It begins during the silent compensation phase when everything still looks fine on paper. Understanding that changes everything about how you read the signals your body is sending. So, let us get into those signals. Starting with number 1, needing to urinate more often than usual, particularly at night. Most people assume this is just a hydration issue or something that comes with getting older. But here is what your body is actually doing. When glucose levels in the blood climb above a certain threshold, your kidneys, which are constantly filtering your blood, start excreting that excess glucose into your urine. But glucose is a large molecule, and it drags water out with it. So your kidneys are now producing more urine volume than usual just to manage this overflow. The result is more frequent urination. And because this process does not pause at night, you wake up 2 times, 3 times, sometimes more. If you used to sleep through the night and now you do not, and no other obvious cause has been identified, that change in your sleep pattern is worth noting carefully. The second sign flows directly from the first one, feeling constantly thirsty even after you have already had plenty to drink. When your kidneys are pulling extra fluid out of your body to flush excess glucose through urine, your body gets depleted of water faster than usual. Your brain detects this and triggers the thirst response to make you drink more. But if the glucose situation is not resolved, the cycle just continues. You drink, your kidneys flush it out faster, you get thirsty again. This is not your body malfunctioning. It is your body doing exactly what it is designed to do. But the cause driving that thirst is not simply dehydration. It is an underlying blood sugar issue that no amount of water alone will fix. If your thirst has meaningfully increased over the past several months, especially if it sits alongside any of the other signs I'm about to describe, please write that down and bring it to your doctor. The third sign is one that genuinely confuses people because it seems like it should not be possible. Feeling hungry, even constantly hungry, even shortly after eating a full meal. Here's the biology behind this. When your cells are resistant to insulin, they cannot effectively absorb the glucose that is circulating in your blood. So, from the perspective of your cells, they are underfed and your brain gets that signal. Your brain does not see a plate of food you just ate. Your brain reads the signal coming from your cells, and your cells are saying they need more fuel. So the hunger signal stays on. You eat, you feel satisfied briefly, and then the hunger comes back. This is not a character flaw or a lack of discipline. It is a physiological miscommunication between your cells and your brain. And understanding that distinction matters because blaming yourself for being hungry when your body is literally sending hunger signals against your intentions is not only unfair, it keeps you from looking for the real cause. The fourth sign is one that has an enormous impact on daily quality of life, but almost never gets attributed to blood sugar. Brain fog. That feeling of being mentally slower, less sharp, more forgetful, less able to focus than you used to be. Your brain is one of the most energy-hungry organs in your body. It consumes roughly 20% of all the glucose your body uses, even though it makes up only about 2% of your body weight. That tells you everything about how dependent it is on stable, consistent glucose delivery. When blood sugar is swinging, spiking high after meals and then crashing down, your brain experiences those fluctuations as instability in its fuel supply. The result is cognitive cloudiness, slower processing, words that come less easily, a general sense of mental effort where things used to feel automatic. Many people accept this as normal aging when it is actually a metabolic signal. And the reason the distinction matters is that metabolic causes are often addressable. Aging is not. The fifth sign can start very subtly, and people frequently dismiss it as eye strain or needing new glasses, blurred or shifting vision, particularly vision that changes throughout the day. Your eye contains a lens that must maintain a very precise shape to focus correctly. That lens is surrounded by fluid, and the composition of that fluid is directly affected by blood sugar levels. When blood sugar rises, the concentration of fluid around the lens shifts. The lens swells slightly, its shape changes, and your focus changes with it. This is why some people notice that their vision is worse after a high-carbohydrate meal and better a couple of hours later. If your vision seems to vary across the day and your optometrist has not found a structural reason for it, that variability itself is a clue worth investigating from a metabolic standpoint. The sixth sign takes a bit longer to notice, but once people see the pattern, it tends to stay with them. Wounds, cuts, and bruises that heal more slowly than they used to. Efficient healing depends on two things working well together: circulation, which delivers oxygen and immune cells to the injury site, and your immune system, which fights off bacteria and directs the repair process. High blood sugar over time compromises both of these. It damages the inner lining of blood vessels, making them less flexible and less efficient at delivering what the body needs to repair tissue, and it creates an environment where bacteria thrive because bacteria feed on sugar. The same excess glucose circulating in your blood is also present in your tissue fluid, and it becomes essentially a food source for the microorganisms that would otherwise be contained quickly by a healthy immune response. If you have noticed that minor injuries linger longer than they used to, that is your circulation and immune system telling you something important. The seventh sign is one that catches people off guard because it feels like it should have nothing to do with blood sugar. Tingling, numbness, or a buzzing sensation in the hands or feet, or limbs that seem to fall asleep unusually easily. Your nerves are fed by extremely small blood vessels, among the smallest in your body. And because of their size, those tiny vessels are among the first to be affected when blood sugar is chronically elevated. When those vessels are damaged, the nerves they supply start to receive less oxygen and fewer nutrients. The nerve fibers begin to malfunction. In the early stages, this shows up as tingling, buzzing, mild numbness, or unusual sensitivity. Not severe pain, just a background noise that was not there before. The hands and feet are typically affected first because they are at the farthest ends of the body where circulation challenges show up earliest. Early nerve involvement is reversible when caught in time, but damage that progresses for years is much harder to address. If you have tingling in your feet that is new and unexplained, that conversation with your doctor needs to happen soon. The eighth sign is one of the most physically visible, but also one of the most misidentified. Dark patches of skin, usually at the back of the neck, in the armpits, or in the creases of the elbows and knees. The skin in these areas looks deeper in color, almost like a shadow, and often has a slightly velvety or thickened texture. When insulin levels are chronically elevated in the body because your pancreas is working harder to compensate for insulin resistance, that excess insulin circulating in the blood actually stimulates certain skin cells to grow more rapidly than normal. That accelerated skin cell growth produces patches of darker, thicker skin. It is not a stain. It does not wash off. It is not a tan or a rash. It is a visible external sign of something happening inside your metabolism. Many people have been told it is a skin condition and treated it topically for years, never knowing it was pointing to something much more fundamental. If you have these patches and they have grown more prominent over time, please bring that to your doctor with a specific question about insulin resistance. The ninth sign is one that seems counterintuitive, and that is exactly why it so often gets missed. Unexplained weight loss. Losing weight without trying, even while eating normally or more than usual. Most people would consider losing weight without trying to be good news. In this context, it is a warning. When your cells cannot access glucose properly due to insulin resistance, your body eventually has to resort to its backup systems. It starts breaking down stored fat for energy. And in more severe cases, it begins to break down muscle tissue as well. The body is cannibalizing its own resources because it cannot get enough energy from glucose in the bloodstream. So you lose weight, but you feel worse, not better. Your energy is declining. The weight loss is not the kind that comes with feeling lighter and more vital. It is the kind that comes with fatigue and a sense that something is not right. If that pattern sounds familiar, it warrants prompt medical attention. Now, we are at sign number 10, and I want to honor the promise I made at the start of this video. Persistent gum problems. Bleeding when you brush your teeth. Gums that feel tender, swollen, or that seem to be receding. And bad breath that does not go away no matter how thoroughly you clean your teeth. Your mouth is full of bacteria. In a healthy mouth, your immune system keeps those bacteria in check. But in an environment of elevated blood sugar, two things happen simultaneously. First, the bacteria in your mouth have more fuel to grow and multiply because sugar feeds them directly. Second, your immune response in the mouth becomes less effective for the same reasons we discussed with wound healing. So the bacteria gain the upper hand. They produce more inflammation. The gums become infected. They pull away from the teeth. And the bacteria responsible for that infection produce compounds that create persistent bad breath that does not respond to brushing or mouthwash. Here's the part that most people find genuinely surprising. Research has shown that this relationship runs in both directions. High blood sugar worsens gum disease, but gum disease also worsens blood sugar control. The chronic infection and inflammation in your gums sends inflammatory signals throughout your entire body. And those signals directly interfere with how well insulin works. So the two conditions feed each other in a cycle that gets harder to break the longer it goes unrest. If your dentist has been noting gum problems for a few years and you have not been able to get on top of them despite good hygiene, that is a flag worth discussing with your primary care doctor alongside the direct question of blood sugar. Those are the 10 signs. And now I want to take the next part of this conversation somewhere most health content does not go, because knowing the warning signs is only half the value of being here. The other half is understanding the deeper picture of what is happening in your body and what actually produces real, lasting change. Let us start with something most people have never heard explained. Your body fat is not all the same, and the type of fat you carry matters enormously for blood sugar. There are two main types of body fat. The fat that sits just under your skin, which you can pinch, is called subcutaneous fat. This fat is relatively metabolically inactive. It stores energy, but it does not interact aggressively with your hormones or your organs. Then there is a second type called visceral fat. Visceral fat sits deep inside your abdomen, surrounding your liver, your pancreas, your intestines, and your kidneys. You cannot see it or pinch it, but it is metabolically very active. Visceral fat releases inflammatory chemicals and hormones directly into the bloodstream, and those chemicals directly interfere with insulin signaling. Research has shown that visceral fat accumulation is one of the strongest predictors of insulin resistance, often more predictive than total body weight. This is why some people who appear thin can eat first, then move to the rice or bread, and the blood sugar response will be noticeably flatter. $0. Zero equipment, available at every single meal starting today. The second change is a short walk after eating. A study published in the journal Sports Medicine found that even just 2 to 5 minutes of light walking after a meal significantly reduced post-meal blood sugar spikes compared to sitting. Your muscles are one of the primary sites where glucose gets absorbed from the bloodstream. When your muscles are active, even mildly, they pull glucose out of the blood directly without needing as much insulin to do it. This creates a natural blood sugar buffer that no supplement can replicate as efficiently. Stand up after meals and move for a few minutes. That is it. The third is reducing liquid sugar. I talked about this earlier in depth, and I want to reinforce it here as a standalone priority. Drinks are the most invisible source of blood sugar stress in most people's daily routines, and they are among the most impactful things to address. Water, plain sparkling water, and unsweetened teas are not deprivation. They are metabolic protection. The fourth is sleep. Even 1 or 2 nights of poor sleep has been shown to temporarily impair how well insulin works, sometimes to a degree comparable to eating a very high sugar diet for several days. Chronic poor sleep and blood sugar problems are so deeply intertwined that some researchers describe them as 2 sides of the same problem. When you sleep poorly, cortisol rises, insulin sensitivity drops, hunger hormones increase, and your ability to make good food choices the next day is biologically compromised. Protecting your sleep is not a soft lifestyle recommendation. It is a core metabolic intervention. The fifth is stress management. Chronic stress raises cortisol, and elevated cortisol directly raises blood sugar by triggering the liver to release stored glucose into the bloodstream. In modern life, where stress is often low-grade and constant rather than short and intense, cortisol stays elevated and blood sugar creeps up with it. People who address chronic stress often see improvements in their blood sugar patterns, even without significant changes to their diet. This is not a coincidence. It is a direct physiological connection. Now let me talk about something that is also genuinely underappreciated in this conversation, and that is your body's internal clock. Your body operates on a roughly 24-hour biological rhythm that influences almost every function, including how your cells respond to insulin. Research has shown that your cells are meaningfully more receptive to insulin earlier in the day compared to later in the evening and at night. This is not a trend or a theory. It is rooted in the biology of how your internal timing mechanisms govern hormone release, digestion, and metabolic function. Eating your largest meals earlier in the day and keeping your evening eating lighter tends to produce lower blood sugar responses from the same food compared to eating that same food late at night. Even shifting your largest meal from dinner to lunch without changing anything else has been shown to improve blood sugar markers over time. It is a change that requires 0 additional cost and 0 equipment. It just requires rethinking the cultural default of making dinner the largest meal of the day. And while we are talking about timing, there is a phenomenon worth understanding called the dawn phenomenon. Between roughly 3 and 8 in the morning, your body releases a surge of hormones, including growth hormone and cortisol, that prepare you to wake up and start moving. Part of that preparation involves the liver releasing glucose to fuel the anticipated activity of the day. In people with good insulin function, the pancreas releases a little more insulin to handle this glucose surge, and blood sugar stays stable. But in people with insulin resistance, the pancreas cannot respond quickly or effectively enough, so blood sugar rises during those early morning hours. Even though you have not eaten anything, you wake up with blood sugar higher than when you went to sleep. This is why your fasting blood sugar checked first thing in the morning reflects not just what you ate the night before, but how well your body is managing this early morning hormonal process. If your fasting blood sugar is consistently above 100 milligrams per deciliter, Please discuss that specifically with your doctor because many labs still report that number as normal when it actually falls in the prediabetes range, according to current guidelines. Ask your doctor not just whether your numbers are in the normal range, but what direction they are trending over time. A reading of 88 5 years ago and 99 today is a story.